Hello, everyone. Thank you for being here to listen to my presentation. I'm going to be exploring Tennessee and their efforts in shifting the paradigm of successful, sustainable recovery. And today I'm going to be analyzing House Bill 215, Senate Bill 207, and as introduced, this bill enacts the Stopping Addiction and Fostering Excellence Act. This is in alignment with the Support Act that was signed into law in 2018 to develop best practices for operating addiction recovery residences. This bill finds that it is critical that these residences are regulated and function with evidence-based practices and sound operating procedures that center on a safe, sober living environment. And this bill also follows SAMHSA's guiding principles of recovery, that recovery is person-driven and centered, that it's holistic, culturally based, and supported by addressing trauma. The problem in Tennessee that we're currently seeing is epidemic levels of addiction, overdoses, and death. Approximately 70,000 Tennesseans are addicted to opioids. A major problem that arises when someone with an opioid use disorder seeks treatment is that they do not have the environment to sustain their recovery and many times cycle back through an unhealthy environment that contributes to their relapse. Oftentimes, an environment such as a sober living facility is also not able to meet the unique needs of someone recovering from this disorder. Many of these sober living facilities are unregulated and primarily have always been run by recovering addicts themselves who have adopted a culture of strict 12-step facilitation and abstinence only. And while this has been helpful for many in recovery, this bill seeks to adopt more of a harm reduction approach. Not everyone with a substance use disorder is ready to quit outright. Rather, they go through phases of recovery. And this further highlights meeting the client where they're at, preserving their self-determination while offering a standard of care that makes recovery sustainable. This bill seeks to adopt a standard of care that is holistic, patient-centered, and also evidence-based. We need thorough assessment to be able to guide our intervention and treatment that focuses on the unique needs of the client. Now, there are many practices here that are evidence-based that you're familiar with most likely, and then there's the gold standard of treatment called medication-assisted treatment, or MAT. And MAT is the use of medications in combination with counseling and behavioral therapies to provide a whole patient approach to treatment of substance use. 1.27 million Americans are now receiving MAT. And in thinking about some of our at-risk populations, we know that African Americans with this disorder are doubly stigmatized by their minority status and this disorder. And also, while the exact rates of inmates with substance use disorders is difficult to measure, some research shows that an estimated 65% of the US prison population has an active substance use disorder. And also, substance use is prevalent at 20 to 30% among the LGBTQI population, as opposed to the 9% of the general population. We also want to recognize social work's role in their initiatives that align with this bill. LCSW, Beth Sanders, and many other professionals in the field founded the National Alliance for Recovery Residences after seeing that some uncertified residences had questionable quality of care. And right now, they are affiliated with 30 state organizations that currently support 25,000 individuals in recovery. We do want to highlight some strengths of the bill, that this bill regulates recovery residences to ensure successful recovery, and it's also a proponent of MAT as an evidence-based treatment. And some limitations, there are very minimal MAT-specific recovery residences and minimal options for specific populations, such as the LGBTQIA population and culturally diverse populations. And this bill is in direct alignment with some of our core NASW values by providing a service for recovery housing options, advocating for at-risk individuals through social justice, honoring the dignity and the worth of the individual by further destigmatizing those entrenched in substance abuse, and also highlighting importance of human relationships by utilizing others in recovery and the community for support. And so we see an illustration here of all of the components of this bill incorporating a holistic approach to sustainable recovery. Each of these components are incredibly important, but combined together, the individual has all the tools for a healthier, happier lifestyle free of the clutches of substance use and dependence. We do want to make a few recommendations for this bill by creating an interagency working group to increase collaboration among federal agencies, incorporating a trauma-informed approach, as trauma oftentimes is connected with substance use, and also more recovery resident services for rural counties. In closing, we do recognize that managing this tidal wave of an epidemic falls to professionals in many different areas. Key among them are social workers, who make up one of the largest groups of addiction treatment professionals that address critical gaps in the continuum of care. Therefore, social workers are incredibly essential in combating the severity of the opioid epidemic. Thank you for taking the time to listen today, and I hope you all will join us in supporting this bill. Thank you.